So a knee replacement is when someone has arthritis in their knee, so their knee is worn out to the point where they no longer can do activities with the vigor or efficiency, and certainly with the lack of pain that they used to. So with knee replacement, we basically just replace the joint. And in a model such as this would be the thigh bone and this the leg bone. And we basically just take off the ends of the bone and replace them with metal implants. And there's also plastic that goes in between there. In some cases, people have arthritis that's just isolated to a particular part of the knee, such as the inside or the kneecap, and there are partial replacements that can be used just to address those specific areas. So the initial treatment for arthritis of the knee is non-operative. And so when people get to the point where the non-operative means of treatment are no longer effective, that's when they begin thinking about knee replacement. There is no specific thing that would cause someone to have a knee replacement, but usually people come to the office and start asking questions about that when they're unable to sleep at night or they're unable to do the activities that give them enjoyment. So nowadays, knee replacement surgery for the most part is an outpatient procedure where patients come in, have surgery, go home the same day. During that time, they usually have some sort of block from anesthesia, which helps with pain, and then they either go to sleep or have a spinal block. All those cases end up with an incision down the front of their knee where we can expose the bad knee and replace it. Most people are able to walk immediately after surgery and begin their rehab that very day. So people, again, usually walk immediately after surgery. We have certain criteria here at the West Georgia Surgery Center that people have to meet before they are allowed to go home. So they do walk right away. The problem is after a few days, the block wears off and they take a step back in their rehab. So I tell people they can actually see improvement all the way up to a year after knee replacement, but the rehab is difficult for most people. But the tendency is for most people to see most of their improvement within 2 to 3 months, but they are up doing most of their activities within a couple of weeks. So the survivorship of knee replacements has improved since I started practice several years ago. The total knee replacements on average last about 15 years, but we're believing that those are actually underestimating the length of time that they last. Partial knee replacements typically don't last quite as long, but they usually can be converted to a total knee replacement without much difficulty. As far as OrthoWest is concerned, we're very happy with our partnership with Tanner because Tanner has always been willing to expand our technology so that we're at the cutting edge. We were one of the first hospitals in the state to use the Mako robot. They've had robotics experience for 19 years. They're now in 45 countries across the world, and they've done over 1.5 million procedures. We had started again back in 2017 and have continued to use the robot primarily for knees, but also for hips. I particularly use it because I feel like it helps me get more precision and more reproducibility in my cases.